testosterone supplementation and DHEA.
Okay.
So I know some women start in their 30s taking 10 milligrams a week. Some take up to 20, and then a lot of them add it in perimenopause because they feel better, they have better mood, better sleep, better concentration, better workouts. What would you think about women taking this, supplementing with it?
So you're talking about testosterone, correct?
Yes. Yeah.
Okay. First, I want every woman to know, learn it from Serrano, your testosterone levels are always higher than your estrogen levels.
Yeah. Yeah.
When you measure testosterone levels, you measure on nanograms. Okay, that means just forget ng is a value, right? But when you measure estrogen, it's in picograms. That means estrogen is so little that you cannot measure at the levels of testosterone. So women think, oh, men have testosterone, we don't have testosterone. No, actually, girls, as you get older, girls, you have more testosterone than I do. Sure, you do. A bunch of you guys, girls, have more than I do right now. Okay, so be aware that testosterone is always higher than estrogen. Do not believe that women don't need testosterone. Now, an average woman, young lady, good looking like Angie, makes between 5 to 7 milligrams of testosterone, okay, daily, which is a lot, actually. Now, what that testosterone is going to do, of course, depends on your situation or what you're dealing with. Now, do I put women on testosterone? Absolutely. I use injections. I have used oral. I have used troches. I have used sublingual. I have used injections. So it depends. What depends on? It depends on what do you want to get from it. My maximum dose on injection is 25 milligrams.
Okay.
I have never gone over injection once a week.
Yeah. Okay.
Let me think. I don't think Angie have gone. Maybe I've done 35 a couple of times, but I rarely go over 25 once a week. I'm telling you, you're taking 25 milligrams of injection. That should be enough for almost 70% of the women out there. Of course, age, weight, everything else dependent. Okay.
Yeah.
And I will do that. If I'm doing the cream, I would say between 5 to 6 milligrams daily will do it.
Okay.
And that will give you high levels enough to have increased sex drive, to do all the other things. If at those levels, and I know you want specific answers, if at 6 milligrams of testosterone, your sex drive is not increased, it's because there are other issues. Maybe your husband might be, we need to look at something else. Something else is going on. I do not measure the levels the day that I put the cream, but I wait at least 3 weeks on the cream, and then I measure your levels. If I give you a shot once a week, I do not, let's suppose we do it Monday, I'm going to wait 5 days and I do check it Friday or Saturday. Or I would check it Sunday before your next shot. Sometimes I pick a Tuesday because I wait Monday, they can come to the office, because I want to see what you threw at. See, where are your levels before your next shot? Are they high? Are they low? What are they doing? And that's how I check levels. How are you feeling again? Is your sex drive going up? I rarely see side effects at those dosages, Angie. Some people, the biggest complaint, I have a mustache now, or I'm growing hair, or my hair is darker. You see what I'm saying? I rarely, at the dosage that I'm telling you, I rarely see any. Now, of course, everybody is different, but if you have high levels of stress, you might have an increase on hair. And I want you guys to listen to this. If I'm highly stressed, Angie, I'm going to produce ACTH, which is the parent hormone, goes to your pituitary gland and says, hey, I need to make, goes to the adrenal glands, I got to make cortisol. So that increases your, it's called melanocorticotropin hormone. It's a huge molecule, okay? And that will increase color on your skin or your hair. So be aware of that. If you put a person on testosterone and they come, oh man, I have more hair, it's darker. Well, how's your stress? Oh, you know, it's worse. So be aware of those things. You need to ask questions about your patient. You need to have, and that's what I highly recommend when you come to see me. Have a 2-week history of what you eat. Have a 2-week history of what your workouts are. Have a 2-week history of your sleeping habit. What do you do weekdays between weekends? Because I want to know all those things before you come and see me.
Okay. Awesome. Perfect. Same kind of question, but DHEA at this time.
DHEA is the only hormone I take at my age. It's kind of funny because the pharmaceutical industry has a prescription called prosterone. Are you familiar with that?
It's actually banned in Canada for us. We can't get it anywhere. I don't know if you knew
Why?
that. I don't know. I've looked into it. That I haven't really found any legitimate reasons as to why. There's a few sites that Danny and I have ordered it because Danny uses it. It was just confiscated at the border. Some sites we will get it delivered to our house. Other sites we just won't get it at all. It's a banned substance. Yeah.
I got to talk about DHEA. It's one of my favorite hormones. Why? One, it helps your immune system, it helps your brain. And I can go into details. I have. And today, Angie, I'm going to send you an email with a cool book about DHEA. You're going to love it. Okay. Now, there's sublingual, there's sustained release, and there's normal. DHEA is the only hormone that I will not buy it over the counter. DHEA and melatonin. I analyzed myself, DHEA, I analyzed 12. I went to the stores for DHEA. I paid for it myself. Cost a lot of money. How much DHEA on these capsules? There were 12. Only one of them had the DHEA, and he says 10 milligrams. He had 25 milligrams per capsule. Mm-hmm. Okay? The other ones didn't have any or barely any. Oh, wow. I was so disappointed. So that's when I said, okay, forget that crap. I'm not going to buy over the counter because people didn't see the effects that I wanted. Number one. Number two, what I'm going to tell you, because people want to know always levels. What the heck is, I had a female, that came up to my office with a level of 1244, something like that. 1,244. I know. Angie knows levels. In a normal human being, depends on the lab, you should have, the highest is 344, right? That's what they tell you. And the lowest is 24. Okay, that's supposedly, which is not true, but that's what they want. Well, this woman have 1,280. What's her level? I remember now. And she was in my office, and this lady felt great. And I said, "Whoa! So why are you taking so much? I heard you giving a talk." And I said, "I know. I did not say to take whatever you're taking. I did not say to take that." She said, "Eric, I'm only taking 10 milligrams." I go, "What?" And I said, "Okay. From which company?" She said, I bought it over the counter." And I said, "Really? How do you feel?" "I feel fantastic." And I said, "Okay, why are you taking it?" "Because you said if you have SLE or lupus, DHEA really helps you," which it does. It makes a huge difference on lupus. So I was having joint pains. I had no sex drive. And I started taking 10 milligrams. She would do this 10 milligrams during the week, and she would take 30 milligrams during the weekends. And her levels were that freaking high. How do you feel? "I feel fantastic." Of course, I had testosterone, estrogen. The testosterone was high, actually, the free levels, because he was taking DHEA. But she felt great. What did I tell this lady? I was having joint pains. I couldn't go out. Now I can go out. I have no joint pains. I said, "Well, you know what? Let me check it in 3 months. Make sure that your breast exam are all up to date. Make sure that your mammograms are up to, just making sure to protect myself, not the patient." That's kind of a wimpy way to do it. But that way, hey, you're taking it. I know you're taking it. I did not prescribe it, but at least I know you're taking it, But I want to make sure that you're correct on taking it. And that's the highest level I had on a woman taking this, but she felt fantastic. Now, the SLE, completely gone. Not that DHEA treats it or cures it, but it helps a lot, by the way.
Wow.
Oh, tremendous. Everybody SLE should take DHEA. I don't care what I tell you. And when I send you the stuff, you're going to go, "Wow, pretty cool." So I'll send it to you. So awesome. There's a case that the levels are extremely high. It is one of the few hormones that I do not use over the counter. I have a company, and I will give you the phone number right now. It's called Claire, and the phone number is 1-888-488-2488. And the code is 614 if you want to order DHEA. Mm-hmm. Now, they come in 5, 10, or 25. And they guarantee the levels. You're taking 10, you're taking 10 milligrams. The one that I take is DHEA sustained release, and I take it once a day. I had never measured my levels, so don't go based on what I say. I just feel good with my DHEA levels. It helps me with erections. Okay, If I don't take it for an amount of time, I can tell a difference. I know my testosterone levels are not where they're supposed to be, but DHEA makes me feel good enough. I'm strong enough. I feel good. It's a mother hormone. I can make other hormones from it, so I don't worry about it. DHEA is a fantastic, fantastic hormone. It is the most abundant hormone in your body. I want to say that. What is very, very interesting is you can stop DHEA and your levels will go back to baseline. They will not go below what they were before,
Okay.
which is
Okay.
crazy. I mean, and I have hundreds of patients. I was taking now. Remember, they were taking DHEA from over the counter. Were they taking the real stuff? I don't know, but most people, the DHEA levels go back to what they were before. I like to see DHEAs at 150 and more on a woman. And I know they're going to ask you that. And I don't know what your values or or your levels are in Canada, but 150 American, and I use DHEA sulfate. I don't use DHEA free, so because the DHEA sulfate tell me the storage, and I want to know the storage because the lower the storage, usually the more stress you have. So that give an idea of the person. On an average woman, 5 to 10 milligrams will be enough to get your levels up if you're taking a good one. Okay,
Okay.
on a man, and I know we're not talking about men, if you have erectile dysfunction, I'm going to use a sublingual formula.
Okay.
Okay.
So 10 milligrams. And would a woman be able to take this combined with test if she's taking, say, 20
Yes,
milligrams
you
of
actually
test and she can
combine it.
still take
Again,
10?
that depends on the age and the situation. Yes, if you're getting pregnant, no, of
No,
course.
no.
But yes, DHEA. Actually, I have people that want to get pregnant on DHEA. Especially this is going to sound crazy to you, Angie. I have PCOS patients that come to see me. I just want to get pregnant, and supposedly androgens are higher on PCOS. But I found out that the quality of the egg of the
Egg,
woman
yeah.
is dependent on the DHEA, and I give them
I took it
DHEA.
before I got pregnant, actually, and
Yeah,
I think it helped. Yeah.
yes, absolutely. People don't know this. Which is the first hormone that the baby makes?
DHEA, yeah.
Absolutely. When do
Yeah.
they make it? Do you know?
I think, isn't it 3 days after birth or is it
They
no?
make it in you when you're pregnant with the baby.
Oh, wow. Okay.
So people do not know that. Then the baby is born, and the first 6 months, the baby has some DHEA. After that, the baby stops, and when it hits puberty, that's when they start making it again. It's crazy. So
Oh, wow.
babies should not be stressed. So
Yeah.
just be aware of that. So that is awesome, Angie. I'm glad you're telling me. How much were you taking during your pregnancy?
I think it was 10. Yeah, I think it
10?
was
Yes.
10 minutes. Yeah.
Yes.
Second, not during, before I got pregnant.
I know. Excuse me, my fault. Yeah, before
Yeah,
the
yeah.
pregnancy. Yes.
And then obviously when I got pregnant, I stopped everything except for the progesterone.
No,
But
I wanted you. Remember, you talked to me about that. I wanted you on the
yeah,
progesterone.
yeah. Um, but no, that's
You
awesome.
know,
Okay, so they can take it together. Okay, so it's
yeah.
not going to be too many androgens and okay.
No, no. One, I want to answer that. Not too many androgens depends on the dosages there. If I take in DHEA and I'm taking 25, I'm going to give you numbers now because people want to hear numbers. If I
Hmm.
take in DHEA 25 and I'm taking testosterone 6 milligrams, yes, there's going to be a repercussion due to that. It can go to testosterone, maybe, but also can go to estrogen. So it can induce bleeding in some women.
Mm,
But that doesn't mean you're taking too much estrogen. That means that you don't have enough progesterone.
okay.
Got it? So that's why you have to look at everything. One thing that we have not discussed, Angie, and is a must for you. I want you to tell people your experience during your pregnancy, what happened to you, because people are not aware of your quote unquote diabetes and what they did to
Mm-hmm.
you. And you have not think about this podcast, but you need to do a podcast about sugars, diet,
Yeah,
and diabetes.
that's a good
Ah,
idea. Yeah,
oh no,
that's a
that's
great
not a good
idea.
idea. That is an incredible idea because you lived through it. Remember when you had me on the phone when you were at your OB visit and we're talking and you're like, oh my God, this one wants me to go back an insulin shot. And I'm thinking, why? Your levels are perfect. Why do you
Yeah,
want to do that? You need to teach women what you can do with your body by just changing what you're doing, which is
yeah.
really important. That's it. That'll be an amazing podcast.
I think that's a great idea. I think it was you that had helped me through that quite a bit. And there was also a book that I had read. It was by an RN, I think Lily Nichols, I think her
Yes.
name is. So
Yes.
she kind of advocates that as well, the ketogenic diet for gestational diabetes. And I mean, my numbers are beautiful. I couldn't get off nighttime insulin for the fasting glucose levels, but I was able to get off all insulin during the day, and so it was just working like amazingly.
We're talking about hormones, so I got to talk about hormones now that I have Angie
Yeah.
here. Angie called me one day and said, Eric, my sugars are freaking high. How about you? How many units were you taking during the day?
Listen, I would have half an apple, and I think I would have to inject 4 units of insulin just to have half an apple. It was retarded. Yeah.
It's funny. Angie called me, and then I freaked out. I said, "What? What are your sugars?" Remember, I'm yelling at you. You said, "Cannot do this. That's wrong. Insulin
It
can."
would go up to 11 and 12. Like it was ridiculous. Yeah.
Yes, and I will get mad at you. I said, "You can't do this, Angie. Let's change your diet." So remember, you start writing the diet, and you texting it to me. I said, "This is awesome. What are your sugars?" I said, Eric, I stopped insulin. I don't need it anymore.
Yeah, yeah.
And then you go to the doctor, and you text me on Danny texts me and said, "Oh my God, we're getting you apart here." He said, "We're doing absolutely wrong. You cannot do this. You're gonna die, or the baby's gonna die." I mean, they give you all kind of shit. And I told Danny, I said, "Danny, tell Angie just to do this."
Yeah, just smile and nod.
You remember that? I said,
Yeah.
Just say yes to everything.
Because it's pointless to argue with them, you know. At the end of the day, you're just...
You know, they want to do the best for you, Angie. The problem is, even me as a physician, we're taught by the pharmaceutical company. We are taught by the food industry. Those are the people that pay for what you're going to learn.
Yeah.
So in a day-to-day, the medical schools don't want somebody that can think by themselves. They want somebody that they can control. And those are the people that only study. They don't look outside. They don't do nothing else but I got the highest average. And all of a sudden they go to the real world. Oh my God, what I'm going to do? So they do not want people that can say, hey, I'm not going to do that. I'm going to go look at this. So they want people that are soldiers. They do exactly what they want to. And that's what they're taught during the residency and registered dietitians. I did OB for 9 years. I never had a case that was my private patient that the sugars were not controlled almost always with diet. I can tell you. And it's funny that they gave you shit, and I'm glad that you need to discuss it because this is a hormone, insulin. What can happen to you during pregnancy? What could happen? All the things that your baby could be bigger, death, yeah. But they're telling you, oh, the baby's gonna die if you don't eat carbohydrates, and it's crazy. So
I did eat carbs. It was really important, the timing. So for me, it was always late evening, like not late. When I say late evening, I don't mean like before I go to bed. I mean like 4 or 5, between 4 p.m. and 6 p.m. type thing. That's when I would have the carbs. It would never be more than like, I don't know.
You didn't go over 35 grams, I think.
Yeah, and then I would also make sure that I had a protein source or a fat source to like slow down the metabolism. And I mean, you can have carbs. It's just choose them.
You have to choose them wisely.
Yeah.
What type and the timing and when. And I said, if you work out, I detail you have some carbs.
Yeah.
Otherwise, and then going to bed at night, have some carbs. Otherwise, stay away from them. No breakfast. I told you, I don't want you having breakfast. You had, kind of funny, I asked Angie to do this for me. Angie's anal. Angie had everything, every little detail. It was awesome. I said, oh my God, I want you cooking for me. Angie's menu was like a freaking restaurant. I said, Danny, is she bullshitting me or what? I said, no, Eric, she cooks that way. And I'm thinking, damn, I cannot believe it. Looks and cooking. I'm impressed. That was pretty awesome.
Food is one of the many pleasures of life. So you have to, and it's also the answer to so many health issues. So
I know, but Angie, you had a menu.
What you eat.
No, you had an actual menu. It was it was never the same. It was always different. It was different things. I was like, what the hell is she doing? I almost told you, I said, you know what? Keep track of everything. Send it to me. I'm going to put it on a pamphlet and I'm going to pass it to my pregnant ladies so they know how to eat. That was awesome. You should write a book about this, but that is up to you.
Thank you very much.
No problem.
I think I'm going to have to end it here for today, just because you've given us a lot of information, and I think maybe we can another time, if ever you want to come back or anything like that, you're always welcome.
You have my number. Give me a call and we get together again.
Okay, great. So yeah, again, thank you for everything today. And for all the new lady subscribers or all the new ladies that are watching today, please like and subscribe, and we'll definitely put up more content for you guys in the near future.
Thank you. Have a good day, Ange. Bye-bye.
Thank you. You too.
Bye-bye.